So now you know the concepts of one surface is fixed and then we move the other surface. You can understand that suppose I put something under here and blocked his humerus from moving. Now suppose I come over here and I push his scapula this way. Isn't that the same thing as the head of the humerus gliding in this direction?
Correct.
So that may be an option for you. And you can, if it's difficult or cumbersome, you may even go on the other side and come in here like this and push down. But I'm pushing on the coracoid process. So I know that with the coracoid process, I'm pushing the scapula.
You don't have to worry about distraction.
Just the fact of this being blocked, it kind of, remember, it's like
Please knees.
as long as I don't hear a grinding or feel a grinding, I'm good. We'll get to the wrist where you actually feel it going if you don't distract. This is not as common that you feel it, but you can always use this hand to pull out a little bit. This is enough. It's enough. All I'm trying to do is so that it doesn't grind.
Can you see your position of your hand? Because it almost looks like you're actually applying the painful pressure to his coracoid.
Yeah, well, actually, if I was going to do it for real, I would actually, for me, do it on this side. And I would come over here, and I'll come in here like this. Now, is that painful? So, my pressure of my thenar, the pressure is all the way around here, and I've got the coracoid. And I can use this hand to kind of reinforce, stabilize my wrist, and then I want it in this direction, right? We would mobilize this anterior medial because of the glenoid fossa. I'm going to push the glenoid fossa posterior lateral. Another way that you may see in the clinic, did you show them the prone method?
Not yet, no.
Let's have you flip over.
Sorry.
Now I'm going to try to, you can either fold one of these in half, you can get you'll see people use a towel. What you're trying to do now is block, I'm going to have you scoot that way as far as possible. You're trying to block the coracoid process. So as long as this is medial to that, what we call that deltoid fold, deltoid pec fold right here. Now I'm on the coracoid process or clavicle, and then I'm going to push the head of the humerus anterior medial. Can you see how there might be a problem with this method?
Sorry.
Can you see how there might be a problem with this method? Well, I can actually set him up.
You're okay, Ron. You don't have to.
You okay?
Yeah,
Good.
I'm good.
I could stabilize here, and then I use my right here to push anterior medial. What might happen?
Table.
I might run into the table. So then I get in a matter, oh, can I bring him off? How far do I have to bring him off before that won't get in the way?
Yeah.
And so that was originally, but I like it because I can use my body weight, right? So that it has advantages and disadvantages. I don't like it because it's very hard to stabilize the scapula. It's very hard not to run into the table. And so, although you may see it out in the clinic, say, oh, I understand what you're doing. You kind of, yes CI, no CI, do the best you can. And then you say, what if I did this? Would that be okay? And then you can kind of test your CI out. Some CIs were really nice and patient, and some CIs, anybody have a bad experience? Well, that's good. I had 2 good experiences and 1 bad experience. One where they told me, basically I was their aide. I just did whatever they told me to do and I passed. But the other 2, they helped me learn. And so it's, if you come across that, be sure and let Carol know. She's the person to contact. Is that good enough? The last thing I want to make, I have you turn back over. You've learned some different. Justin, would you grab me a pillow? Let's make him more comfortable here. I can actually help stabilize the scapula by placing this on the scapula. Now I don't have, yeah. Let's have you scoot as far over as you can. There you go. Let's put this under your head.
Oh, there we go.
Is that better? So now
Sorry.
I can do everything that Jeremy was doing. I supported the lower arm or the forearm and hand. I support the elbow. Now I don't have to use this as my mobilization hand. Now I don't have to stabilize here because the table stabilizes him. Now this head of the humerus is free to move, but you feel like, I don't know, is it uncomfortable?
No, that was good.
It shouldn't be uncomfortable, although it looks uncomfortable. It stabilizes the scapula. Now I know I need to go posterior lateral for a posterior glide or anterior medial for a anterior glide, but I can actually come in here, straighten my elbow, come in here and do a posterior glide. By leaning in, that makes me push down and out, or lateral. So, last concept that I want to make sure you get for the written test. What position should the arm be in when I perform my joint mobilizations?
Towards the direction of the movement.
Hmm?
Towards the direction of the movement you're trying to achieve.
Okay, so I think I see where you're going with that. I want to go into the motion that they're limited in. If I'm doing a grades 3 and 4, what position should they be in if I'm trying to do a grade 1 and 2? Open pack. Where's the open pack? 55. Is that close enough? So it's close. You're never going to get a goniometer out there and measure, right? Did he say all this? You already said all this stuff?
Yeah, that's good.
Okay.
I mean,
You got him on tape.
That's why I say towards the open pack position. And then I can come in here and do my distraction or glide.
Will you do an anterior in this position?
Can I?
Yeah. Oh, how will you do it?
Oh, then I have to stabilize here.
Oh.
Because as soon as I do this, it wants to protract more, so I need to stabilize. So that's why when I do it, I come in here and I'll grab like this. See, because you protract, I take up the protraction range of motion and then I'll stretch. But now I'm really going medial because the scapula is fully protracted. But on a big person, girls, small hands, big guy, boom, come in here. And then what we call it, we use the pit rags, just a wash rag. Put it in there so that they, Oh, sorry, I'm being filmed too. But,
all over YouTube.
yes. But this is a good method. But can you see that if you can't grab around here and you are not strong like this, it's going to be, how hard can I? Sweat's pouring off, right? So I'll get in here and I'll really get down in here like this. And I'll go, okay, let's protract it.